Well, welcome everybody tonight to our housing is health. And we're so glad you're here, both in person and virtually. I'm not exactly sure where to look, but first I want to thank Lily Dearwater for making this possible, because there's a lot of technology going on to make this possible. And but we're excited that you're here. And my name is Charles Mayer. I'm a family doctor, and I'm a co-chair of the Economic Inequity Task Force. And we are here to improve health, and we're going to talk about that just briefly. And we're glad that you're here to help us do this work. So I'd like to introduce the person who's really going to do more introduction about our story, and that is Amy Svensson, and she is in Spokane, Washington. So Amy, thank you for taking over. If you're there, if not.
I was muted. Can you all hear me?
Oh, yes.
Okay.
Can we see you? We're trying to see you.
Here she is.
She's behind me, so let me get out of the way.
All right. Looks like my face is up there. All right. Thank you, Charles, and welcome again, everyone. Again, I'm Amy Svensson. I'm a naturopathic doctor here in Spokane, Washington, and I'm a member of the WPSR Economic Inequity and Health Task Force. So I just want to tell you a little bit about our organization, Washington Physicians for Social Responsibility. We're a health profession-led advocacy organization. And as Charles said, we're working to create a healthy, just, peaceful, and sustainable world. And in this way, we leverage the voice of health professionals and those passionate about our work to educate the public, influence decision makers, and promote policies that support our mission. So we focus on three areas, three of the areas that we feel affect human health the most. So or have the potential to: nuclear weapons, climate crisis, and economic and racial inequity. And we do that through our task forces. So tonight's event was put together by the Economic Inequity and Health Task Force. And we really focus on passing state policies that address the main drivers of ill health, racial, and economic inequity. Again, I'd like to thank my fellow committee members, Lily Dearwater, Charles Mayer, Lexi Leitner, Hunter Furantani, and Kimmy Stevens. All right, so moving on to the next slide. So what brings us here? Despite being one of the wealthiest nations in the world, we have an ever-rising homelessness crisis. Just as ill health can cause homelessness, homelessness can also cause ill health. And as health professionals, we are uniquely positioned not only to see this impact on our patients directly, but to use our platform to make meaningful change. So today, we're going to better understand the root causes of poor health and health inequity, to build coalition and community so that we can be effective together, and to build our own personal capacity to be powerful advocates for health justice. All right. So thank you.
Nice.
So as we begin on our conversation about homelessness and its causes and solutions, it's important to highlight two of the groups that are most affected in the US. For people of color, and in particular African Americans and Native Americans, the compounding effect of social inequity and racist US policies make the likelihood of becoming homeless much higher. So this photo here, which is up, is what our country looked like in 1492. There, as you see, Native tribes lived all across the country. However, due to genocide, illness, forced movement, consistently broken contracts, many Native Americans now live in very limited areas and suffer a greater disease burden and housing insecurity. Native Americans only make up about 1% of the population, yet 15% of those that are unhoused. Let's see, I think,
Or at least comparable in cuteness.
Yeah, they don't have his personality.
I'm
so
sorry,
that's
could everyone mute?
maybe Trump stuff, but you're right. I think 1%.
All right, well, I'll just continue.
Yeah, I think, let me see if, I think maybe our room mute is
you
the
can
one that's
mute 'em.
messed up. I'll fix it.
Okay,
Is that among our household, little
Oh,
percentile?
You can, as a presenter, you can mute people.
Probably, definitely.
oh, okay, I'm not sure who's talking, so.
Danny Lowe.
Amy, I'll try to,
Okay. Um, all right, I'm gonna keep talking and maybe someone can mute Danny.
I did it.
Oh, okay, perfect. Sorry about that, everybody. Okay. So Native Americans only make up about 1% of the population, yet 15% of those that are unhoused. This disproportionately points to the historical and present oppression that directly paves the way to our current homelessness crisis. All right, and so here I'd also like to examine homelessness among African Americans. And to do this, we have to understand our country's distribution of power and wealth in order to make our nation healthy and whole. As this graph shows, in 1800, the US had the lowest GDP of all these countries. But in just 70 years, it surpassed them by becoming the largest economy in the West and soon in the world. The key to this was the cotton that was grown on stolen native lands and through the uncompensated forced labor of enslaved African people. And despite being at the center of Americans' development as an economic superpower, African Americans have been systematically excluded from its benefits through injustices such as redlining, disproportionate criminalization, and the racial wealth gap. To continue, these continue to contribute to the overrepresentation of Black Americans among those experiencing homelessness. Today, Black Americans make up about 13% of the population, yet make up about 40% of those experiencing homelessness. In order to come closer to close the health justice gap, we must examine the causes and solutions to homelessness through a racial justice lens. Okay, next slide. Thank you. Many of us that work with those that are unhoused are facing housing insecurity. We know firsthand the relationship between housing and health, and that it's a direct relationship. The life expectancy of a person experiencing homelessness is only about 48 years, and lack of stable housing, food, hygiene, healthcare, and income make it nearly impossible to be unhoused and also be healthy. So in other words, homelessness makes you sick. And robust scientific literature shows us that even as the only intervention, becoming housed will make you healthier, use less drugs, alcohol, and a lot less government resources. So this is what brings us here. This is what we are focused on. And with that, I want to thank you all so much for being here. I hope that you find this presentation impactful and informative, and I fully hope that you will join us in making Washington healthier. So now I'm going to pass it off to Kimmy, who will present to our amazing panelists. Thank you.
Awesome. Come on up, Kimmy. Thank you so much, Amy.
Thank you, Amy.
Thanks.
I have now.
You are.
Yeah.
I don't know
She's
what
in
screen-
Spokane.
What screen do I look at?
Yeah. Hold on. This was where, what can you all see? Gallery view. So have fun with, this is our wild experiment doing a hybrid meeting. So bear with us throughout the technology. And that, Kimmy,
That's it? Oh, we're switching. Okay.
no, I mean,
This
you
is
stay
well-
here. I'll be
Oh,
back.
okay. We're well choreographed.
I'm just gonna get this going, but you can start introducing.
Okay. Hi, everybody at home and hi, everybody here. I'd like you all to meet next Representative April Berg. She is an exceptional leader who represents the 44th District of Washington. She is the chair of the House Finance Committee and has a background in business and aerospace management. Notably, she is the first Black woman to hold this position and represent her district. Representative Berg has been actively working on very important issues. She has written and supported laws to fight child hunger, make college more affordable, and address poverty among students. She has also played a significant role in passing a $1.5 billion construction budget, which has led to investments in housing, economic development, early learning, and broadband internet. In the upcoming legislative session, Representative Berg will be sponsoring the Affordable Homes Act, showing her commitment to making housing more accessible for everyone in Washington. Let's give a warm welcome to Representative April Berg, who is dedicated to making a positive impact in our communities.
Thank you so much for that introduction. And it's great to see everybody in the virtual world and as well in the in-person world. So thank you all for coming out tonight. I was really excited to be asked to speak at this gathering. It is literally my mantra when I go out into community talking about housing, talking about the intersection of housing and healthcare. And truly, housing is a human right. Housing is healthcare. And the only way to keep folks healthy is to give them housing first. And so that must be at the first and foremost of everything we do. So that said, we made historic investments last session in housing. We did, I think, $400 million for our housing trust fund. But the sad truth of that is it was not sustainable. We did not give it a sustainable revenue source. So we made the commitment, but we did not give it sustainability, which would allow for some of our partners, and some of which are on the call tonight, to make those real investments in housing. What you need to make investments long-term is that long-term commitment. And as state policymakers, it is my goal to give you that commitment. So we are reintroducing the Affordable Homes Act, and that would give you a sustainable revenue source for housing. And the question becomes, well, how do we do it? Because, you know, it'd be great if I could print money and money grew on trees, and it doesn't. So we had to come up with some creative funding solutions to get there. And what we saw was that we have, and I think everybody on this call knows, we have one of the most regressive, actually the most regressive tax code of any other state in our nation. We are doing the worst. We are doing the least. The folks who have the least are paying the most. It is absurd. And so what functionally happens is we are under-resourcing things like housing. So one of the ways we're looking at paying for the sustainable source for housing is by increasing our transfer tax, our real estate excise tax on when someone sells a home. Now, I love to be very transparent about this tax. It is for those of you, it will hit those of you who sell your homes that are over $3 million. So I think I heard a collective sigh, like, oh God, not another hit to our bank account. But really, you know, I joke about it. And there are people out there who have homes that are worth that amount. But I will tell you, that is the very tippy top. And that is not the majority of working families, even close. So one of the reasons why we've done it this way is so that we can make our tax code a little more progressive. And so it will have folks who are selling homes that are over $3 million paying an additional 1% tax on the transfer, the sale of that home. So I say that, and I'm saying it really intentionally, transfer, because we are going to call this extra 1% a transfer tax, and it will only affect homes over $3 million. The other thing we're going to do with our Affordable Homes Act is actually lower the tax burden on folks who are selling homes under $3 million. So if you think about our excise tax, our current way of taxing when you transfer ownership of a home, you do pay a tax. Everyone pays it. It's called our real estate excise tax. We will basically be lowering it for homeowners that have homes worth under $3 million. So the majority of working families will see a tax cut. You will have some families see a tax increase when they transfer the sale. And again, it's not just homes, it's also properties. And that addition, that kind of delta between those two numbers is going to go into a sustainable source for homes. It'll go into 5 buckets. One is for our Apple Health and Homes. One is for our housing trust. We're also going to fund supportive housing. intellectual and developmentally disabled housing, as well as farm worker housing. So it will go to housing. And it will be our promise and our commitment as a state to Washingtonians that you will always have a roof over your head, because housing is a human right. I was excited again to come out and talk about this good little bill that'll be making housing more affordable for more people across our state. But also, I'm here to let you know that we're going to need your advocacy, because this is going to be a heavy lift. Anytime you talk about real estate, property, increasing fees, taxes, cost at all, I will tell you right now, there's going to be a lot of folks coming for my neck, and it's going to be the folks who are going to be paying that tax. And so I'm going to need folks like you, working families in community, people in community, to write letters, show up, show out, and talk about the importance, the absolute importance of a bill like this to make more homes affordable for more Washingtonians. This will lead to better health outcomes. This will lead to better communities. And again, this will be a sustainable resource that all of our community partners can count on when making housing investments. So with that, I just want to make sure I leave time for questions, because I see some amazing folks on this call. And so, yep, there will be questions, and I am happy to take them. And if I've missed anything, I can always double back to it too, but I can go ahead and open it up for questions. And I don't know if you guys want to raise hands or how you want to do it. I see Carrie with your physical hand up. Why don't you go ahead, Carrie?
Hi. So thank you guys so much for this opportunity for us all to come together tonight and collaborate about healthcare, as well as housing being a disparity towards full integration. In 2015, Jay Inslee signed the bill for full integration, meaning mental health care, chemical addiction care should be as together as one with medical. A lot of folks in the Clark County region were trained to be whole health action management facilitators. It's called the WHAM program from SAMHSA and HRSA. Clark County would not allow us, not one of us, to implement the program that the government asked us to do. As the adopter for full integration, we were supposed to be a role model. And we're talking about housing. I would like to amplify a couple things about housing. Folks that are disabled on Social Security with a fixed income, most likely they do not have a high credit score. And when a person becomes displaced and they have to look for a home, most management companies literally will go under a FICO score. A FICO score is all your credit bureaus together. I had 0. That left me with nowhere to go. Also, people would like to talk about putting everybody under a same roof, having all of the abilities for them to get the help they need under the same roof. But nobody has talked about single family units with amplified space for people that are very highly affected by a lot of other people. Nobody talks about that. And I would really like that to be part of all of this conversation. These things, they are all together. And if we actually were to backstream and put the money out for housing first, then we would have the opportunity to help the people. But if our clinicians won't even allow us to do what SAMHSA and HRSA asked us to do in 2015, we're really missing the point of the whole program of full integration. Thank you so much for your time.
Yeah, Carrie, and thank you for your question and for your comments. So I think it's important to get some of those things out there, and definitely in a forum like this to be heard. So thank you for that comment. And yeah, we'll take it back. And I saw one over here from James. And so basically, James, looks like you're asking if we have an estimate for revenue. So we do. It's right around $200 million per year. It's 400 for the biennium. So it came up to what the current investment of the Housing Trust Fund was. So I say that it's a little squishy because DOR is still running the numbers, and our current economic forecast has going down, has our excise taxes going down a little bit. Some of that is due to supply constraint and less houses being sold. So at the current numbers, it's right around 200 million. And then Melissa has a question with how many homes over 3 million. So Melissa, I will tell you, I am ineloquent sometimes when I speak about this bill. It is properties. It is going to be all properties over 3 million. So that will include homes, but that also includes commercial real estate as well as multifamily. So, so it's quite a lot. There are a lot. We are breaking it down by county, especially when you talk about single family ownership, so that we can see what the effect and the impact is county by county. But because we're talking about properties overall, there are quite a few. So thank you for that question. Any other questions?
We have, you want to tell other people in the room?
Oh, yes.
Oh, yeah.
And how do we get there? Can I hear?
If you have a question in the room, would you mind coming up near the laptop so that the virtual folks can hear you?
Or I
Like
can
said,
sit
we're
for
figuring
you.
it out as we go.
Come sit right here,
Yeah,
and then
There
you
you
can
go.
see.
probably, yeah, we'll have time for both these.
There you go. Perfect. You're right there. See? Perfect.
Hi,
Hey.
hi, Rep Berg. It's Christina Wong.
Hey, Christina. I thought that was you.
I know,
I'm like squinting, like where, like I think that looks like Christina. Good to
It's,
see you.
It's good to see you, although it's funny because you're talking to my head, the back of my head right
Oh
now.
yeah.
So I just wanted to ask, you know, REIT was tried last year in a year where it's not an election year, and we know that this is going to be an election year, and how difficult it is to convince legislators to talk about progressive revenue, let alone any revenue. And so I'm just wondering if maybe you can help share what might be really good talking points that people should be honing in on to help make the case. What kinds of stories are you looking for?
Yeah, thank you so much for that question.
Okay.
You are really right about the advocacy and the strategy around that. This is a short session. It is a session that is right before an election, which folks in my position tend to pay, I think, a little too much attention to, but we're still going to get good work done. So part of our thinking with this new version of REIT, right? So it's kind of a REIT 2.0 from what we had last session. The reason why it's 2.0 is because first off, we are upping right now, the REIT kicks in at right around $525,000 when you sell a home for that value. We're going to actually up that to $1 million. So that's going to create that tax decrease that I talked about. So this bill will overall, for the majority of Washingtonians, be a tax decrease. And so that's the messaging that I'm talking with my colleagues about, that we are getting right. The other piece of it is, who does it help, right? So for me, being finance chair, revenue needs a reason. And so the reason for this revenue is to build more affordable homes, get more people housed. So the type of stories that we need from across the state, east and west of the mountains, are stories about folks who need homes. And frankly, folks who need homes is a part of their healthcare, about a part of their treatment, a part of their, why. I mean, poverty is an economic policy choice, and it's a bad one. And as policymakers, we continue to make bad choices. So this Affordable Homes Act is a good choice. And having stories from community about the impact of having affordable housing available will just be everything. And again, we need it from across the state so that all my colleagues can see their communities in this bill. But you're absolutely right, Christina. It is an election year. Folks are going to be thinking about that, because it will be an increase on some homeowners who have high-end homes. But more importantly, it's going to be an increase also on property owners that are commercial real estate folks and things like that. So those folks are going to, say, hey, why do we have to pay more? Well, because this is a part of being in a community that's healthy and whole and that's housed. And that's why their rates are going to be going up. But that said, the more letters that we get with real life experience, lived experience in writing to my colleagues, that makes all the difference. So thank you for that question, Christina, and great to see you.
Thank you.
Awesome. So we have two more questions, one in the room, and then I see your hand raised online. And I think that's what we'll have time for. So feel free to pop over here and do our in-person one. And then Hector, we see your hand.
You're right here.
Hello, Representative Berg.
Hello.
This is kind of a technical point on the $3 million mark. And I'm wondering if I remember back when we tried to get an income tax through, and I had sign in my yard, and I had a neighbor come down and say, well, yeah, it's 250,000 now, but when my kids are working, they'll have to make that just to get by. I'm wondering, is there any technical way that the $3 million mark can be tagged to something so that it kind of moves up with inflation?
Good question.
But
Yeah, and that is
it
a
gives
great
us a little
question.
better arguing point, I think, sometimes too.
Yeah, no, and that's a great question. And I will say, so right now, the way the bill is written, there's not going to be any kind of inflationary scaling to that 3 million. And part of it is because our current progressive REIT has 4 tiers, and that top tier is what you would have for your homes above $3 million. So it kind of tracks to our current REIT system. I will say, as legislators, everything is very iterative. And so this current REIT model that we have, the progressive REIT, was voted into law in 2019. And so this is our next tweaking. We're going to be in 2024, kind of tweaking it, adjusting it, to your point, raising that cap, because back when we did it in 2019, $525,000, I think that was right around the median home price in King County. And clearly that's not anymore. It's closer to about 850,000. So we're now taking that law, saying, look, let's move that cap up to $1 million, because that really represents more of your almost median in some of our more expensive counties. So at that other end, that 3 million, if in 3, 4, 5 years we feel like, okay, that actually is getting closer to what working families are paying for a home, which my heart stops thinking about that. I've got kiddos who are entering the housing market. I'm thinking, oh my gosh, but if that becomes the case, we would absolutely be able to go back and tweak that that particular piece of it. And just, you said the I word, so I do want to talk about it, the income tax. So one of the reasons why we are doing a progressive REIT is because it is an excise tax, and we are able to make excise taxes progressive. Part of why we don't have an income tax in our state is not because we can't have one. We could have an income tax. It just can't be progressive. So that means you, me, and Bill Gates would all be paying the same income tax. And that's just not fair. And so that's why we do things like REIT, where we can, with excise taxes, be progressive, so that we can say, based on the value, based on the actual asset that you're selling, we can say how much tax you're going to pay, because income is seen as because of income in our state, uniformity per the Constitution, we cannot be that progressive. So that's why we're doing it this way for REIT, and we aren't doing it that way for income. So thank you for your question. And it looks
All
like
right.
we have
And Hector has a question.
Yes, hello.
Thank you.
Yes, my name is Hector Nosa. I live in Clark County. One of the organizations I'm involved with is named Community Roots Collaborative, and we build small homes, small permanent homes for homeless at this point. We've successfully built one small neighborhood of 21 homes. We're working on a second project, and that'll be completed by early part of next year. What we've found so far is we've found money in the state, and luckily Vancouver, Washington has passed an affordable housing fund here, renewed it just last year. And the issue that we have right now is securing land and figuring out a way to secure that land before the for-profit developers are able to close on it. Certainly they're able to do it faster than we can. So that's a headache. And so moving forward, I do just basically want to introduce myself, because I have a feeling that we will see each other in the future, probably in Olympia. So I'm looking forward to those conversations. And yeah, the troubles we are having right now, as far as the funding and grants we get from the city and from the state, is that we're not able to build houses where we can actually, where folks can actually buy them. We're basically having to stay with a leasing program with the homes, because we have so little property that if we sell these homes, then they'll go straight into market rates. And what what we're able to right now, rent at $650 a month, all inclusive with utilities, they would immediately go into market rate and they'll go to $1,200 a month or whatever.
Mhm.
So that seems to be a stumbling block for us to control the prices and be able to actually provide low cost housing for folks.
Yeah, and
Shut up now.
oh
Thank
no,
you.
you're good. No, I was just going to say thank you for bringing up all those issues, because that is exactly why we're doing the work we're doing. The one thing I did want to say is that the certainty that this funding source is going to bring will hopefully help with some of those purchase issues that you kind of alluded to at the beginning of your comment, because that's the biggest issue, is that when you one-time funding is great. Again, I love the fact that we were able to give $400 million to our housing trust fund, but the folks that are pulling out of that are saying, look, we can't know that with certainty every year the legislature is going to make this kind of investment. So as a result, they can't go out for bonds. It's difficult to buy. It's difficult to plan. And so part of this revenue is certainty, and that certainty will help in those scenarios that you laid out. Now, the other piece of it is keeping stuff affordable once it comes out of the affordable bucket. And that's kind of another piece of policy that I'll just kind of stay in my lane on that one. But I will say I have some amazing colleagues doing things around rent stabilization and affordability, and building affordability into units much past kind of the 8, 10, and 12-year mark. So we're cognizant of it, and we're still trying to get it right, kind of get that dial right on there. So thank you, Hector, for that question. One question before I jump off, I want to address in the chat was, why can't we have a progressive income tax? And I just want to make sure I make this super clear. So what we're doing with the Affordable Homes Act is we're having an excise tax. So an excise, think of it as transfer. When I sell my car, I pay an excise tax. When I sell my house, I pay an excise tax. It's now I'm realizing that wealth, realizing that gain. And you might hear that language similar to capital gain. So we have a capital gains tax now that is, again, when you realize a gain of over a certain amount, you're now paying a tax, and that tax is going to education and other good things. What we can't do is tax pure property. So like your assessed value of your property, we can't do that progressively taxing it. So my property tax value and Walmart down the street is going to be the same. And that is bad, right? It sucks, because I don't have as much money as Walmart, but yet we're still paying kind of that same, our value is still the same. It has to be uniform. And that's in our state constitution, this uniformity clause. And income is considered property in our state. So we have to tax income uniformly. And that's why we can't have a progressive income tax. That's also why our property taxes on their face are not progressive. Now, when you sell that property, that excise, when you transfer, then we can have a progressive tax. And that's how you get our real estate excise tax being progressive, as well as this new real estate transfer tax. So not to get too wonky, but I just want to make sure folks understand we're trying to use every tool we have to make sure our system is more progressive, so that those who make the least are not paying the most, but we only have so many tools. So I need more votes so that we can get uniformity out, because it was put in at a point where our state entered the union. It was a little bit after the Civil War. And frankly, many states still looked at a person like me as revenue, and to be the chair of revenue. It's a very surreal experience. So uniformity is one of those bygone things that we need to remove for all the good reasons. So hopefully that answers it. And you guys are amazing. So thank you for the work you do. And thank you for just everything you're doing in community and all of the great questions tonight. So it was great to see everyone.
Thank you very much.
Thanks. Have a good night.
Excellent. Thank you. I can hold Carlos too if you need me to.
While we're changing, I just want to mention too, we've got these great handouts that you can get online. One is on the Affordable Homes Act that we just spoke about, and please pick up one. And the other is our Mythbusters, which is there's a lot of myths out there about how it works with people who are homeless and the causes. So take a look at that.
Excellent. And people at home, you can go to our webpage and you can download the Mythbusters and other documents, one pagers that'll help you write letters to your legislators. And then also think about becoming a member of WPSR. I'm a registered nurse, and I called and I said, can I join? I'm not a doctor. And they said, of course you can. You just have to be an advocate for health. So please join us. We need people on our team. And with that, I'm very delighted to introduce Michael Fairchild. He was born in Misawa, Japan. His father was a communications specialist in the Vietnam War, and he was in the Air Force. That's why he was over there. He grew up in various locations along the West Coast, including Bremerton, Washington. And he owned a very successful painting business called All Star Painting for almost 20 years. However, due to becoming disabled, he lost everything and found himself unhoused. Despite all of those hardships, Mike remained determined and recently celebrated his 3rd month of being housed after being many years without a permanent home. Alongside him throughout his journey has been his loyal canine companion, Carlos, who has been by his side for 13 years. I've had the opportunity to meet Mike and Carlos through my nonprofit in Kitsap County called Their Voice, which assists unhoused individuals with their pet needs. And their story has taught me about inequities faced by unhoused people in terms of housing and health. They've inspired me to continue assisting and advocating for those who are at a great disadvantage. And thank you, Mike, for sharing your story with us.
My name is Mike Fairchild, and I'm just going to read this because I am not a public speaker of any sort. So you're just going to have to watch me read this paper I wrote. I have been asked to share a condensed version of my life experience with you when it comes to healthcare, both mental and physical, from a homeless person's perspective. I'm just expressing how things were for me during the 6.5 years of homelessness that I experienced. I was very privileged to have a broken down motorhome, so I wasn't in a tent on the side of the road, but I didn't have running water. I couldn't use a bathroom. There was no refrigerator, no stove. You know, it was just a shell that would keep me dry. So, I mean, I was very grateful I had that, because otherwise you get real wet. But it was still real cold. You know, it wasn't that great. I did have electric cord, so I could get a light on, you know, but you couldn't run a heater from it or below the breakers. Anyway, no fridge. We already covered that. I can say in my experience, when I became disabled and lost the income I was used to, while fighting to get Social Security, and even once I got Social Security, it's been difficult. I had lost my identity as a painter or a contractor. I was living in conditions most people would not be successful in. I lost all self-value, self-esteem, and I could feel the judgment from other people. Basic hygiene was not able to be kept up. I smelled bad. I didn't look all that great either. There came a point I just gave up. I went through the motions of doing the things I had to do to take care of my dog, Carlos, but I was beginning to fall short on those things also. I was not going to doctors or dentists or any kind of mental health places because I didn't want the ridicule or the looks from other patients or even from the doctors when I was in the office, let alone to go to see a doctor when you couldn't shower really often and your clothes were filthy, and you're not able to do laundry, is not really what I wanted to do. I didn't seek mental health help because depression had sunk in way too far at that point. I could say that it took me actually dying 3 times the night before Easter this last year for me to get out of the hole depression had on me. I went 15 minutes without oxygen, and the doctors had called my parents in to say goodbye when they went to unplug me from life support because there was no way I was not brain dead when I sat up and opened my eyes.
Andy pulled his breathing tube out.
Yeah, I started pulling up and I don't know. Now, I've been told this story. I don't really remember any of this. I was at St. Michael's Hospital. I don't remember any of it at all. My memory kicks in again about 2 days later. Since this event happened, I've had the help of a couple dear friends, one of which showed me so much love. It was an overload to me. This person and her, what I call secret friends, Kimmy, and she has these secret friends that have invested quite a bit in me. So much time and money and love in my life have I've been able to stop smoking cigarettes, and I love smoking, but I went from 3 packs a day to 0. I don't do drugs, I don't drink, I don't even drink soda anymore. And I drank probably half a case of soda a day. I'm now for the 3rd month in a temporary home. I have no desire to do any of the stuff, you know, the smoking. I don't even want to, because it's I have no desire to do the things I had done before, and I have a desire to live today. I'm at almost all the doctor visits I have. Some of them I don't make. I've started going to the YMCA to get in better shape for my heart's sake. Because of the massive overload of love that came from some family, close friend, and a bunch of total strangers, I'm getting better today. I feel it's the only way I can thank them for seeing in me something I didn't see in myself. I can say that, in my opinion, housing is very important. I am able to stay clean and do my laundry every week. I don't stink, I don't look filthy, and this helps me feel better about myself. My dog is in much better living conditions, and we both are much happier than we were 7 months ago. I've been waiting on housing for almost 7 years now. While I was in the hospital fighting for my life, the housing people sent me an email because I didn't have the ability to check the email. My place was given to someone else, and I am now back on this mystery wait list. They tell me I am second in line for a place. They just can't tell me when that might happen. It could be another 7 years. So they don't know how long this might be before said place is open and available. I'm glad I have the temporary place I am in now. I just hope and pray something opens up before I no longer have that option.
Thank you, Michael. Thank you very much. Awesome. I can't believe Carlos didn't bark for you.
I know.
He really wanted to. Thank you so much. We appreciate you. No, you're fine. All right. Lots of hearts for Michael and Carlos. All right. To keep on track here, I'd like to introduce you to Ma.Caroline Lopez, a dedicated advocate for equity and racial justice. As the Director of Equity, Racial Justice, and Culture for the Housing Alliance and Housing Action Fund, Ma.Caroline works to dismantle white supremacy culture. They provide training, lead affinity spaces, and promote racial justice. That's Carlos. Ma.Caroline is also involved in various organizations such as the Southwest Washington BIPOC Legislative Work Group and the Washington State Commerce Equity Collaborative. They believe in the power of individuals to create transformative change through everyday acts. Let's recognize Ma.Caroline Lopez for their exceptional efforts in promoting equity and racial justice.
Thank you so much. Thank you so much. I'm gonna share screen for a moment here, and hope everything else goes well. I just have to like move everything. So thank you so much for the introduction. And I also wanted to share a little bit about the real me, and I promise that this is all quite relevant. So as I arrive here today, I do not arrive alone. I'm here with my ancestors. I am the descendant of Lolita Malabanan Alonso, who's the daughter of Maria and Adriano Sr. from Cavite City, Philippines. I am from a home where all four of us slept in one room, and I think that was until I was 7 years old, with many cousins, aunts, and uncles in one house. I'm from a home where fried fish that my family caught from the ocean and fresh rice was warm in the cooker day and night. I'm from the smell of lumpia, plum sauce, pancit, mango, toasted coconut, halo, fresh fruit trees, and roses in the yard. I, like many of you, were probably from LPs, cassettes, mixtapes, Huffy Dirt Bikes, Doc Martens, Sun-In, and Aquanet. But I'm also from multitudes, spiritual lineages, from Venerable Geshe Kelsey Gyatso from Tibet, Thich Nhat Hanh from Vietnam, Pastor Vicky Goldston from Alabama, political lineages from the Filipino diaspora, the Gabriela activists, Black and brown queer feminist organizers, healing lineages through Adrienne Marie Brown, and you can see in this picture, Aida Quadrado Bozo, Trish Shum, Vivica Chen, and my Power 50 Women of Color Sisterhood, one of which is on this call today, dear Hema. And I'm poured into by my lineages, nourished and inspired by my partner, Leandro, and my daughter, Nioma. And I come from love in the best way that my ancestors knew how to give it, despite a history of colonization, occupation, imperialism, and forced migration. I am here due to the systems that were put in place that brought me here. I'm here with all of my experiences working in sexual assault emergency responses, in direct homelessness services for 7 years, and in policy, advocacy, and racial justice in the housing justice movement for the last 4 years. I'm here with my family, my coworkers, my friends. They all come here inside of me. I come with love, peace, liberation, and ancestral wisdom. And this is my power. And I'm meant for this moment. And I'm ready to be advocating with all of you. So I am Ma.Caroline Alonso Lopez, and I use she and they pronouns. And I decided to share my I am poem because you may not realize that you were not alone coming here, even if you physically arrived by yourself. With you are your ancestors, those who raised you, and the environment you were raised in. You are here due to policies that were enacted in this country and maybe even other countries. With those policies, you may have benefited from some or most. You may have been harmed by some or most, particularly in this country. And I say this because even when policies have been deliberately discriminatory towards some, we all lose out. We all suffer. We are all impacted, though in vastly different ways, depending on if we were part of one or more historically excluded or marginalized populations. And this impact is much greater if our intersecting identities include identifying as Black, Indigenous, both, or a person of color, and especially if your skin has more beautiful melanin. For instance, through the delusion of white supremacy, you may not have heard it in that way, has hurt all of us. And this is not about interpersonal racism. This is not about being a white identified person. This is about the systems that were created by those in power in order to stay in power. And so this is Bell Hooks on this slide. It's a beautiful author who passed pretty recently. And she uses the term white supremacy delusion because this delusion is something that was pulled over our eyes due to colonialism and imperialism and perpetuated by capitalism, patriarchy, and anti-Blackness within this country. White supremacy was built into our infrastructure and into our culture, which is what I'll also talk about. But it's really important for us to understand when Bell Hooks says that this originates from systems, not individuals. And that's what we're talking about as far as policy as well. Those who are in power had what we call now affinity bias. They created systems so that they could stay in power. And this meant acquiring land and natural resources. I really appreciate the other map that was up here earlier too. They did this through proclaiming ownership, AKA land theft, because they were quote unquote civilized and more quote unquote worthy or blessed than the indigenous people. They committed genocide through laying waste to the resources needed to live through acts of violence, pushing Native peoples to agriculturally desolate areas without access to water, salmon, their way of life, and a connection to home. And when I say genocide, I mean genocide. In the pre-colonial Americas, the probable estimate was about 60 million indigenous people. And then by the 1600s, 56 million of those indigenous people had been killed, and their main way of life, which was farming, was systematically destroyed. The census counted 332,000 American Indians in 1930, including those on and off reservations in the 48 states. And this year, the Census Bureau counted just under 6.8 million people, indigenous people in the US. So in 500 years, indigenous communities are only at 11% of the population that was before colonization. And I also want to note that American Indian and Native Alaskan data are always undercounted and always in confusion, which only adds to the continuous erasure of indigenous people. And so that was just like the first of, history and policies. And there are many more, continuing to having people from Europe and the Americas kidnapping 12.5 million indigenous people from Africa through the transatlantic and intra-Americas slave trade. The Americas were built on human trafficking, where Black people were treated as commodities to be bought and sold and violated into subjugation and forced labor. And after the Emancipation Proclamation, slavery took on many other forms through oppression, segregation, and redlining. And you can see within, this is a very small list of policies, but these are some of the main ones which may be familiar to you. And so you can see, right after slavery, Jim Crow laws took place, Black codes and segregation, the Chinese Exclusion Act, redlining, as we know, and restrictive covenants, which, we were still fighting for as of last year. We're still, there's still so much more as far as reparations for that. Racist lending practices. You may not all know about the GI Bill of Rights, where people came after war, or I should say military came after war, and they were told that they could buy homes. But what wasn't told to them that it was only there were only white folks who could have access to those mortgage loans in order to buy a home. And instead, there was public housing where there were forced relocation into projects, as some of us have lived through gentrification and displacement, and now, rent hikes that are over like 100% for some people, and people that I know even in like mobile home parks where they own their home, but they don't own the land, and are getting, $200 at a time rent hikes. And especially a lot of those folks, it's their retirement. And, they live under some kind of fixed income or another too. So, I don't know, it's just story after story. When you're working with the Housing Alliance, we get to hear a lot, which is good for us, as far as like why we were pushing for all these bills. And then of course, the nationwide housing and homelessness crisis. But I list these policies because they are also connected to our cultural norms. So racist policies become part of culture. You may not have that or put that connection there, but I'm going to try to help you with that a little bit. It becomes part of the system of the delusion of white supremacy, just like we were talking about earlier. So policies stay because of the popular belief is still the supremacy of whiteness. So I wanted to read these cultural norms, and you can think for yourself if you're still experiencing this, if this is, some of the waters that you are in, experiencing anti-Blackness, whether or not you're Black, you can be experiencing it, seeing it, knowing that it is happening. Colonial mentality, where the standard is white. Even as a person who identifies as white, the standard itself is not something that's actually attainable. The rules, professionalism, paternalism, individualism and competition. So that goes with capitalism, race-coded language, and that is everywhere in policy, race-coded language, creating stereotypes and stigmas. And this is because there's still that belief, and because it's in policies, it's everywhere, it's in media, we believe it, and then we keep perpetuating it, we keep adding it to the narratives, as well as violence and fear. And so you can see these cultural norms in the data of who lives in rentals, who lives in homes, who lives in which part of the city, where are fresh fruits and vegetables, where are more healthy supermarkets located, where are there only convenience stores to be found for miles, and an overwhelming amount of fast food restaurants. Which schools receive better funding with safer, updated facilities, smaller classroom sizes, and more support for academic success and overall wellness? Which neighborhoods have well-staffed and well-funded medical facilities and health clinics where you don't have to wait all day? And where do you have to wait all day or come back the next day? Including care that is culturally specific and easily accessible, and which places do not. But there's also a movement towards liberation. And so some of these, actually, they kind of go with one another. That being pro-Black is being pro-everyone. We recently had a speaker for our org talk about how to build a pro-Black organization. And so at some point, I'll point you towards that. We don't have the video up yet, but we will. And we'll also have a video up on re-indigenization and how that helps people on the planet. So practicing re-indigenization, practicing pro-Black culture norms leads us all towards liberation. If they are liberated and free, so will we be. Centering people with lived experience, like Mike, who you heard from today, vulnerability and trust building, collaboration versus that individualism, being community-centered, and unlearning and deconstructing the narrative. So having that critical thinking when you hear what's, you kind of feel it in your body, you're like, something doesn't feel right. And there's some kind of race-coded language. There are books on all race code. There's a book called Race Code, and you can see it's like, wow, it's really been embedded everywhere. But once you start feeling that, it's up to us to change that narrative in our mind and also talk to people about it, and moving into love, care, and respect. And so Audre Lorde says that the true focus of revolutionary change is never merely the oppressive situations that we seek to escape, but that piece of the oppressor which is planted deep within each of us. And so we are swimming in those waters of white supremacy delusion. And so Audre Lorde is challenging us to look to see where does that lie within us, or what is the cultural norm that I am taking for granted that is perpetuating. And so that is to say, I believe that it is our social responsibility for us to support culture change while also fighting for policy change. So, and I want to share one way that I practice moving toward liberation. And so I am very fortunate to be able to supervise Master of Social Work interns from UW. And some of those are on a clinical track, some of them are on a macro track to do more things that I do too. But I share this so that if you supervise students or anyone really, I encourage you to discuss and make connections So clinical students and people who work in direct service of low to no income people, I asked them to make a connection between the person they're serving and the systems that impacted that person's life. So you can see some connections over here. I'd ask them to make a connection to like, what are the origins of their state of health? What are the origins of their housing instability, of homelessness? And if this is something that you don't regularly do or haven't done before, I challenge you to make this connection in your own practice or with people you serve. So how you could do this is when someone walks in the room, you can ask yourself, or also work towards having trusted, vulnerable conversations if that's something that you've built as part of your relationship. You know, who is this person coming into the room with? Who are their people? Where do they come from? What environment did they grow up in? What systems are they connected to? Are those systems well funded? Were they displaced within the US or other countries? So we know when you don't have a safe, stable home to thrive, your health, well-being, and future opportunities, and most everything else is impacted. So, you know, if you know that there are some things happening with folks, you can make that connection, because I think part of the problem is, and this, you know, comes from our you know, individualistic society, is believing that the person is the problem, that they did something wrong, when in fact, if you search with a critical eye, you see the connections, and you can see where our policies have let people down. What are the other barriers where healthcare and housing have failed to offer accessibility to quality care? And yeah, I would venture that you can tie every person to systems that have impacted their lives. And it might not even be them directly, it could be a generation before that. And then if you know, or if they're aware too of, you know, what happened to their families, like in my story, there's a lot of political strife, there are a lot of things that happened. And I feel that generational trauma. And then I'd also encourage you to do this for yourself. You know, what brought you here? Who is with you? Who and what are you carrying with you, to make that connection, just like in my I Am poem, and make one yourself. And the last thing I want to mention, and you might have heard of this too, it's up here on this slide, is racial weathering, or weathering. So you may have heard about this. Public health researcher Arlene Geronimus from the University of Michigan says that the traditional belief that the disparities are due to genetics, diet, and exercise don't explain data that accumulated over years. And instead, she makes the case that marginalized people suffer nearly constant stress from living with poverty and discrimination, which damages their body at the cellular level and leads to increasingly serious health problems over time. And so Geronimus coined the term for this chronic stress, weathering, in which she says, literally, it wears down your heart, your arteries, your neuroendocrine systems, all your bodily systems, so that in effect, you become chronologically old at a young age. And so this helps us to see and recognize what is really happening and what it does to you biologically. And if we want to eliminate health disparities or promote health equity, she says we have to attend to what's happening in these different settings. So health is truly connected to these housing policies. And I'm really thrilled to know that you're here, all here to take action. I love that we've been working together for years too on different bills, and to make these connections for yourself so you can see it within yourself and you can see it within all the different people that you serve. And so lastly, of course, I want to invite you to take actions with the Housing Alliance, and especially during the legislative session. And I will be putting in the chat the link to where you can take action with us too. So thank you so much for having me here. And
thank you very much.
Thanks.
Thank you. All right. Matt, little
Thank you.
commercial.
Great. Just want to pass around a piece of paper for the folks in the room, just to make sure we have your name and your email address, and make sure we get you on our, that we stay well connected.
Yes, please. All right. So now I'd like everyone to meet the next speaker is Gregg Colburn. He's an associate professor of real estate at the University of Washington's College of Built Environments. With a strong background in housing and homelessness, he has published research and co-authored the book, the very good book, Homelessness is a Housing Problem: How Structural Factors Explain U.S. Patterns. Gregg's educational achievements include an MSW and PhD from the University of Minnesota, as well as an MBA from Northwestern University. Before entering academia, he gained valuable experience in investment banking and private equity. Passionate about addressing homelessness, Gregg serves as the co-chair of the University of Washington's Homelessness Research Initiative and is a member of the National Alliance to End Homelessness Research Council. Let's acknowledge Gregg Colburn for his dedication to researching and finding solutions to housing and homelessness issues.
Thank you all. Thank you all. And I'm going to share my screen if that's okay here.
Yes.
So I've got about 20 minutes, so I'm going to speak quickly, and I hope I don't lose you. I'm not going to go through everything that I have in my slide deck here, but I am going to get through some of the main arguments that we make in this book. Let me just get this to full screen. Screen just went blank.
You just froze for a minute.
Okay, are you seeing that okay?
We're not seeing presenter view, but we're seeing the presentation.
Okay, how about let's try this one. How's that?
There you go. Perfect.
Great. Thank you. You would think after about 4 years of living on Zoom, I would be better at this, but it takes a village. Okay, well, thank you all for the invitation. I am pleased to join you this evening. And I also want to call out the good work that you all are doing. You know, I actually have had the privilege of interacting with a number of physicians throughout my time researching homelessness, and I really value those relationships. Notably, and some of you may know Margot, but Margot Kuchel, who's an MD, runs the Benioff Homelessness Research Initiative at University of California, San Francisco. And Margot is one of the leading, if not the leading, homelessness researcher in the United States. She does so from the perspective of a physician. And, you know, and Margot has been a great supporter of the book, which is fun because I'm a social scientist and she's a physician. And it's interesting, she gets asked to testify all over the United States, and she was recently at the California legislature giving a talk and testifying about the problem of homelessness from her perspective. And she said to the folks in the legislature, I am a physician, and what I'm telling you is the best thing you can possibly do to help the health of my patients is to get them housing. It's really, really hard to heal people who are unhoused. Because the life of people who are not stably housed is terribly traumatic. Physical, sexual assault, obviously sleep is impaired. We're not eating well, not going to regular physician's appointments, et cetera, et cetera. And so this connection between housing and health is central to the understanding of homelessness. And so while I approach this from a social science and market perspective, I just wanted to highlight this important connection. And so the purpose of this book was really to explain for a general population, why is homelessness so bad in Seattle? Why is it bad in Seattle, San Francisco, Los Angeles, Boston, New York, Washington, D.C.? I was just in St. Louis and they don't have homelessness. I was just in Detroit. I don't see this. What is going on? That's the purpose of this book. And it's to take an evidence base that has existed in the academy for 20 years and translating that and packaging it in one volume. Such that if someone's walking around trying to understand what's going on, that they can get some answers in this particular book. So that's the book. So obviously we need to talk about causation. And so you can't write a book about the causes of homelessness and the drivers of homelessness without really diving into causation. And one of the challenges with causation is we have a unit of analysis problem, meaning the causes of homelessness at the individual level are different than they are at the community level. And that creates confusion for people. We also have a variety of different ways of knowing, meaning we generate knowledge about this phenomenon in different ways. One of the ways is we ask people experiencing homelessness, why are you homeless? This is part of the point in time count that's conducted every January. We do surveys, we ask people questions. They give us very blunt answers. My boyfriend beat me up and I ran away, and now I'm homeless. I drink too much, and now I'm homeless. I got in a fight with my roommate, she kicked me out, and now here I am. And so we honor those explanations, and the Seattle Times gets a hold of them, publishes them, and says, here are the causes of homelessness. And I sit in my office at the University of Washington and kind of scratch my head. Who am I to tell someone that's not why they're homeless? That's not my place. But I also fundamentally don't believe that divorce is the cause of homelessness in the United States. Certainly divorce in the wrong set of circumstances can produce homelessness. No doubt about that. No doubt about that. But if my wife and I were to get divorced tonight, and I hope we don't, neither of us would be homeless tomorrow. So the point is that these are certainly factors and can drive people to homelessness, but we would argue they may not be the fundamental root cause of the crisis. And so what we try to do in the book is draw a distinction between what we would call root causes and what we would consider to be precipitating events, which would include domestic violence or relational breakdown or drinking too much, et cetera. The way we highlight this is the analogy or metaphor of musical chairs. 10 friends, 10 chairs, a leader starts the music, pulls a chair out, the music stops, and now you got 10 people scrambling for 9 chairs, and by definition, someone loses. In this case, it's Mike. He was on crutches. He had sprained his ankle, and he lost the game. And if we asked him after the game, why'd you lose, Mike? He'd say, I had a bad ankle. Of course I lost the game. So within the specific rules and conditions of this game, it probably was the causal driver of Mike losing the game. But if we take a step back and think about this structurally and ask, why was Mike chairless? It's because we didn't have enough chairs. This is exactly what's happening in our coastal cities right now. When housing is scarce, people who are vulnerable in some way, shape, or form, they're physically disabled, they've been discriminated against because of their race or ethnicity, they're addicted, whatever the case may be. People who are vulnerable are going to lose this vicious game of musical chairs. And so when we walk down 3rd Avenue and we see Joe on the street, we say, of course Joe's homeless. I saw a needle right next to him. He's addicted. What we're missing is the structural deficit of housing that's causing people who are on the margins of society to fall into homelessness. And that's far more pronounced in our coastal cities than in other places in the nation. So what I don't want you to do is leave this talk, and some people do, and say that Gregg doesn't think drugs are a problem. They absolutely are. We know that addiction, mental illness, and poverty increase the risk of experiencing homelessness. But we also know that those conditions produce homelessness at high rates in some geographic contexts like Boston and Seattle, and not in others, which should cause us to ask what the heck is going on. So in the book, we ask a very simple question, which is why do rates of homelessness vary so widely throughout the United States? Why does Seattle and San Francisco have 5 times the per capita homelessness of Indianapolis, St. Louis, Detroit, Cleveland? And we ask that question because if we can give a credible answer to that question, it should tell us something fundamental about the drivers of this crisis. And we can then focus our time, attention, and resources towards that root cause or the fundamental driver of the crisis. And it would be easy, and a lot of people do this, is to say, well, if drugs, mental illness, and poverty cause homelessness at the individual level, if you have more people with those conditions in a city, you'll have more homelessness. That's a perfectly plausible explanation. It turns out it's not accurate. So the thesis of the book is that tight housing markets accentuate vulnerabilities and produce homelessness at much higher levels. And the individual vulnerabilities that we read about in the Seattle Times every single day are really the sorting mechanism. They're the factors that are identifying the people who are most likely to experience homelessness when housing is scarce. So I'm not going to spend much time on this, but what I just want to demonstrate for you that, in fact, we do have huge variation in rates of homelessness. Some places count at the city level, some places count at the county level. Neither place is right or wrong. It's a bureaucratic nuance. But the point is whether you need to compare cities to cities, because cities have higher per capita rates of homelessness than counties do because of suburban lower rates of homelessness in suburbs. But what this shows you is that when you compare cities, New York City has about 5 times the per capita homelessness of Indianapolis, about 10 per 1,000 people 10 homeless people per 1,000. And Indianapolis is about 2. When you move to the counties, the numbers are lower because you're including suburban locations. But interestingly, the relationship is identical. It's 5 to 1. LA County, Santa Clara County, King County, Multnomah are 5 times Hillsborough, which is Tampa. So this is massive variation. Not 20%, not 30%, 5 times. So we should want to understand, why is this happening? Why do we have this variation? So the logic of the book is, what we do is we take all the conventional explanations for homelessness and we test to see if it helps us understand regional variation. If it doesn't, we cross it off as a credible explanation and we move to the next one. And I'm not going to go through all of them tonight, but if you are so interested, the book goes through each of these explanations in more detail. So we start with some individual explanations. The most obvious being poverty. Poverty causes homelessness. There's no doubt about it. But when you plot rates of poverty and rates of homelessness, what you see is there's actually an inverse relationship. Places with really, really high rates of poverty actually have lower rates of homelessness. So the lower right-hand corner of this graph is Detroit, Michigan, the most impoverished city in the United States that has far lower rates of homelessness than very affluent cities like Seattle, San Francisco, and Boston. So the point of the slide is not that poverty doesn't matter. It absolutely does. But the consequences of poverty in an affluent city are very different than they are in a less affluent place. So homelessness thrives amidst affluence. That's the point of this slide. Serious mental illness. This is state level data. The data on drug use and mental illness are better at the state than at the city or county level, but it's the same analytical logic. There is some variation in rates of serious mental illness across states in the United States, and it bears zero relationship to rates of homelessness. So our homelessness problem in Washington is not driven by a disproportionate number of people experiencing serious mental illness. Every state in the nation has people who are mentally ill. The consequences of mental illness might be very different in coastal states than in the interior of the country, but it's not disproportionate presence. So we can't blame our crisis on more people who are mentally ill. The same story exists with substance use disorders. People are using and abusing drugs in every state in the nation, with some variation, and that variation bears zero relationship, almost zero relationship to rates of homelessness. This is when some people start to get irritated with me and send me angry emails. And I'll say to them, if you fundamentally believe that this is a drug problem, you would then need to explain for me West Virginia, the home of the opioid epidemic in the United States. Terrible, terrible substance use disorder problems in West Virginia. They don't have a homelessness problem. Why? Because people are able to access housing. So the point is that people are using and abusing drugs in every state and city in the nation, and it manifests itself as homelessness in some contexts and not others. Is that a question, or was it just background noise?
Background noise, sorry.
Okay, race, and the previous speaker was speaking about this. We can't talk about homelessness without talking about racial inequity in the United States. Black, brown, and indigenous people are 3 to 4 times overrepresented in the population of people experiencing homelessness. But what's interesting is when you plot race and rates of homelessness, you actually find zero relationship, and in some cases a negative relationship. Meaning the demographic composition of the city doesn't explain rates of homelessness. Race doesn't cause homelessness, racism causes homelessness. So Chicago has a much higher Black population than Seattle, but actually has far lower per capita rates of homelessness. So the point is that racial inequities help to explain who is more likely to experience homelessness within a given city. It doesn't explain regional variation. So none of these individual factors help us understand why Seattle has 5 times the homelessness of Chicago. We got to keep looking. So local context. Greg, we're screwing up here. There's something about our city that's causing this crisis. One is weather. If we didn't have moderate weather on the West Coast, we wouldn't have all this homelessness. LA is warm, Chicago's cold. Of course, we're going to have more homelessness in LA. What this analysis ignores is the fact that Boston is really cold in January and has lots of homelessness. And Miami and Dallas and San Antonio and Phoenix are really warm in January and have very relatively low rates of homelessness. So the narrative makes sense when you compare LA and Chicago, but when you zoom out and look at the nation as a whole, what you'll see is there's basically no relationship between weather and homelessness. We've got to keep looking. We can't blame Mother Nature. Greg, if we didn't have such generous benefits, people wouldn't move here and we wouldn't have this crisis of homelessness. This argument has been made in almost every city I visited. Everyone thinks they're a magnet. Everyone can't be a magnet. So this is a graph of TANF, which is the primary federal welfare program, largely for women and children. There's actually huge state-to-state variation in terms of generosity. This was baked into the program when it was passed as part of Bill Clinton's welfare reform in 1996. So we can actually test, do generous states attract more homelessness? And what we see here is that you have some stingy states, you have some really generous states, and it bears zero relationship to rates of homelessness. What this says is not that benefits don't matter. The point is that people are not sitting back somewhere experiencing homelessness and trying to optimize their outcome. They're not looking at the relative generosity saying, look at Iowa. I think I might move to Iowa. We don't see that. We know from all sorts of social science research that people, that state-to-state mobility falls with income because moving's hard. If you have no resources, are you really going to leave Seattle and move to Topeka because it's a little bit more affordable? Especially if your social network is here in Seattle. No. And we have ample research demonstrating that to be the case. That doesn't stop people from making this argument, but the data absolutely support the idea that this is not a mobility story. Margot Kuchel, who I referenced at the beginning of my talk, just published an amazing report of homelessness in the state of California, the epicenter of homelessness in the United States. And what did they find? 90% of the people experiencing homelessness in California are from California. So is there an anecdote of someone who moved? Of course, but we shouldn't make policy based on anecdote. Homelessness is a homegrown problem, and we need to recognize it as such. Politics. If we didn't have left-leaning politicians in the West Coast, we wouldn't have homelessness. Microcosm of the Trump argument when he was in office. This may be good news or bad news for you, but Democrats run cities in the United States. In the 13 years of our sample, 85% of the time, Democrats were in charge. So if you want to blame Democrats in Seattle and San Francisco for homelessness, that's fine, but you would then need to explain why Democrats have not produced a massive homelessness crisis in Chicago, and Cleveland, and St. Louis, and Baltimore, and other cities that have been run by Democrats for a long time. Now, Democrats aren't blameless. I think we can point a lot of fingers at West Coast Democrats who have not allowed for sufficient housing production, which has exacerbated this crisis. So it's not a free pass, but just the simple narrative of left-leaning, softy, permissive Democrats are at fault for this crisis doesn't really hold up. So housing market explanations. By far the most convincing statistical explanation we have in the book are these two next slides, which are median contract rent. Where rents are high, homelessness is high. A related variable is vacancy rates. When vacancy rates get below 5%, which is considered the neutral point in a rental market, when vacancy rates are really low, homelessness is much higher. And so when you put these two related variables together, is it a perfect predictor? No, but it's pretty darn good. If you have places with really high rents and low vacancies, you're going to have a problem with homelessness. And there is not an exception to this rule in the United States. I wish there were, because we could learn a lot from them, but there isn't. There isn't. And so this is, if you just give me, don't name a city, just tell me what their rents are and their vacancy rates, I can tell you with a fairly high degree of confidence if you're going to have a problem with homelessness. So the question then becomes is, if these are really, really important factors, why do some cities like Seattle have really high rents and low vacancies? Is it because a whole bunch of people moved there? Is this an Amazon story? As it turns out, population growth and homelessness don't correlate very much. Why is that? Well, there are actually a lot of fast-growing cities and counties in the United States that have not had the same problem with homelessness. Charlotte, Austin, Phoenix, very rapidly growing Sunbelt cities have not had the same issues that Seattle, San Francisco, and Boston have. So what's going on? The point is that those cities have constructed a lot of housing. They have very elastic housing markets. When people move to those cities and when prices went up, they build a whole bunch of housing. Urban economists have taught us that places with really strict regulatory environments where it's hard to build housing and with challenging topography, mountains and water, have inelastic housing markets, meaning they don't build much housing. San Francisco has the most inelastic housing market in the United States. Very strict regulatory environment and challenging topography because of the mountains and water that surround San Francisco. And so when you layer a population and wealth boom on top of a really inelastic housing market, what do? You get a massive housing crisis that manifests itself as really, really high rents, high home prices, and lots of homelessness. So the way that we can look at this visually is plotting a few of the cities in our sample on this slide. So the x-axis, change in population, you can think about that as a proxy for housing demand. More population growth, more demand for housing. The y-axis is supply elasticity. 1 is the neutral point for elasticity. Above 1 would suggest that you build a lot of housing when prices go up. Below 1 would suggest that you don't build enough housing. It's an inelastic housing market. So the upper right-hand quadrant is really interesting to me, which is the Sun Belt. These are fast growing, just as fast as, they've grown just as fast as Boston, Seattle, and San Francisco. They've grown very rapidly, but they've built a whole bunch of housing because they have really elastic housing supplies. And the numbers in parentheses are their rental market vacancy rates. They were able to maintain relatively high rental market vacancy rates in the face of rapid population growth by building a lot of housing. The bottom right quadrant in which we find ourselves is the perfect storm for a housing and homelessness crisis, which is a whole bunch of people move there and you don't build enough housing. And what happens? You end up with razor thin, below 3% vacancy rates are terribly, terribly low vacancy rates, suggesting we have a deficit of rental housing. So while tragic, while this housing and homelessness crisis is absolutely tragic, it is absolutely predictable. And it's really, really frustrating because we watched San Francisco go through a tech boom before us, and we did not act sufficiently quickly, and now we're dealing with the consequences. So I frequently hear, well, Greg, we spent all this money on homelessness, the problem got worse, obviously this isn't working. And I would argue that that's the wrong interpretation for 2 reasons. One is we're not thinking about the counterfactual, which is had we not made these investments, the problem might be much worse than it is right now. The second point is that a lot of our investments around homelessness are a response to the crisis, not an intervention to prevent it. Shelters and the crisis response system are life-saving. I think we have a moral obligation to provide those services, and I'm grateful to the people who do that work. But if that's our only societal response, waiting for someone to end up at the shelter door, we're treating and responding to the crisis, we're not intervening upstream. What we have not done is prioritize investments, capital investments to construct housing, and particularly housing that's affordable for people with lower incomes. And if we don't do that, I fear that we will continue to increasingly rely on a crisis response system to respond to an increasing population of people who are precariously housed and experiencing homelessness. Who should build this housing, Greg? Everyone. I get called a socialist and I get called a shill for corporate interests at this point in my presentation. Do I think we need a lot more private market development? Yes, I do. And hopefully it's dense and multifamily housing because we desperately need it. But we also, I firmly believe that the private market alone cannot address this fully. So we need private market developers to build, and then we need public resources to provide subsidy to low-income households or to subsidize the construction of housing that's more affordable for people with lower incomes. We need to do all of that, in my opinion, to really change or change the trajectory of this crisis. So the point of this book was to hopefully take attention off the individual experiencing homelessness. If we continue to blame the individual for the outcomes that they achieve, we ignore the structural drivers of this crisis. And it's much easier for me to go about my day if I see Joe on the street and say, yeah, Joe made some poor decisions. I feel bad for Joe, but I can go about my day. If I see Joe's condition as a consequence of a structural establishment in which I am a part of that and have contributed to that, then I have some responsibility. I, Gregg Colburn, have a responsibility, and all of us in this room have some responsibility. And what's scary about that is structural problems tend to be big. And structural responses tend to take political courage and a lot of resources and things that are at times in short supply in our nation. And so the final pushback I'll get is, Greg, Joe's a mess. People have actually said those exact words to me. I don't think housing's going to help Joe. And I'll say, why I think it will? Is because we've done this over and over and over. We have ample research to demonstrate that, in fact, it does work. We cut veteran homelessness in the United States by 50% over the last decade. Why did we do that? Because it's good politics to house veterans. Republicans and Democrats voted for this. And how did we do it? We provided housing. For some people, it was simply a voucher. All they needed was a little purchasing power and they were off to the races. Other people with much more fundamental challenges, behavioral health disorders, got housing plus a range of services. It worked, and we cut homelessness by 50% among that population. So the question should not be whether these interventions work, they do. The question should be, will we extend this logic to broader population of people? And to date, the answer has been no. And as a nation and as a city, we're living with those consequences. All right, so that's my rapid fire presentation. I appreciate you you having me, and I appreciate your attention on this really important issue. Thank you.
Thank you so much. Nobody can see me because there's a cord in the way. Okay. Thank you so much. And thank you everyone for joining us tonight. We just have one last thing to show you, which is a really easy action, because now we've told you all this stuff that's happening and we want you to do something about it. And it won't even take very much of your time. So let me share my screen real fast. All right. Perfect. All right. Send a letter to your lawmakers. Tell them to fund the Affordable Homes Act, that real estate excise tax that Representative Berg was talking about earlier. You can go to WPSR.org/housing action, or you can scan the QR code that's on your screen. Do it. It's really easy. It'll automatically go to your lawmakers once you fill it out. Other things you can do if you want to get more involved in advocacy, you can sign up for our action alerts. You see the website on the screen, and I actually will drop in the chat how you do all these other things. You can become a WPSR member or make a donation, or you can also join us at a future event. In January, we will have a legislative session kickoff event, and we would love for you all to be there. It'll be virtual probably, just for everyone in the room's knowledge. And yeah, we'd love to have you. We really need you, because the more people we have, the more likely it is that we can get these policies passed and address these structural factors. And with that, I will drop all the websites you need in the chat for those of you online. And thank you again to our fantastic speakers. We were so lucky that all the people we wanted said yes. There's some applause starting. You can keep going if you want. Great. And with that, I hope you all have a lovely night, and I'm gonna stop sharing my screen so that I can drop that information in the chat for those of you online. Thank you again.